Hi everyone, thank you all so much for joining us today. I'm Allison Warren, and to help get some answers to your questions, we have Dr. Gordillo, who's our Medical Director of Infection Prevention and Control, and Dr. Kirk Volker, our Medical Director of Clinical Research here at SMH. So we want to get right to it, and after I ask just a couple questions to kind of prompt the discussion, I'll give each of you an opportunity to ask a few questions, but just in the interest of time, we ask you limit it to 3 or 4 questions each so we can get the doctors back to work. We will start by Dr. Volker, can you talk a little bit about how things are going with remdesivir and convalescent plasma, which were the 2 first clinical trials we had here in relation to COVID-19?
Yeah, remdesivir, which is the medication that actually works against the virus. We were one of the first to start the clinical trial. It is now open access. We were running low on it. We were essentially out, and now we have a supply that we can treat over, I think, 80 more patients. So we're doing good in the front of remdesivir. As far as the convalescent plasma, and that is when we take somebody's blood who has had COVID before and developed antibodies, and we give it to somebody who's sick with COVID. We're still dramatically low on that. We're in short supply. We need that. And the only way we can do it, we can get it. We can't purchase it. We can't get it from anywhere except from the community. So we need to rally the community together. People who have had COVID at least 3 weeks ago can donate their blood. They can give plasma. And for every person that donates, they can save up to 4 lives. That trial is going extremely well. We've given probably 150 people convalescent plasma so far. So we've had a significant impact, but we're critically low.
Dr. Volker. And Dr. Gordillo, we spoke, I believe it was last week, about the newer trial ongoing here at SMH, the Regeneron antibody cocktail. So can you talk about that and how we're getting ready to actually move into another phase of the trial?
Yes, we started the first trial, which is the inpatient trial for people that have COVID and they're in the hospital. It's going very well, it's going better than expected in terms of recruitment at least. We've recruited 3 times the number of patients that we thought we were going to recruit. So big thank you to all those participants in the clinical trial. And next week, we're going to start the second trial with the same monoclonal antibody cocktail. This is going to be for outpatients. So outpatients that don't need to be hospitalized could be eligible for this study, and we're excited about that one as well. That will start probably Monday or Tuesday.
Dr. Gordillo, that's very exciting, and you spoke at length about why this trial is so important and potentially so wonderful to have here in our community. But it's important to mention that not everyone qualifies for the trial, right?
Exactly. So there are other options for people that don't qualify, and we have other options as Kirk described. So in this particular trial, the one for the inpatient, patients cannot have symptoms for more than 7 days. And the extremely sick ones that are either expected to not survive in the next 48 hours, those also are excluded from the trial. And there's a few other exclusions as well. For the one that we're going to start next week, that requires a positive test and at least 1 symptom. If you have those, you will be able to qualify for the trial.
Thanks, Dr. Gordillo. We're going to go ahead and open things up for reporter questions. So I'll just unmute you and I'll just go as the list shows your names in alphabetical order. So Bob, you want to kick things off?
Yes, thanks. Appreciate your doing this. Allison, glad to see you got the memo about shirt color. First question, the Venice City Council passed a resolution this week to emphatically urge people to wear masks, but not to make them, so it's unenforceable. I wonder what both the doctors would say to the city council next week when they're actually going to consider an ordinance to mandate the wearing of masks in the city.
So we've been saying all along from the very beginning that masks are one of the most important tools and the most important contributions that the public can make to control this epidemic. And in fact, you know, when we control the epidemic in the community, that has this big, huge impact on what happens to us in the hospitals. What happens to us is just a reflection of what's happening in that community. So we have started to see an improvement. You know, we believe that there's, after all the messaging and all of you, all the wonderful work that you've been doing with the public, and some of government officials and public health officials and physicians and nurses and everybody giving a consistent message that masks are very important, just as important as social distancing and all the other things that we do. Now we're starting to see, we believe, a significant bend at the top of this curve. So I think we just need to reinforce that message, and we need to encourage all the politicians and everybody that in government that this is a critical and very important element in the fight against the virus. And if they can move forward with this ordinance, that would be awesome for the hospital and for the public.
Just to add a little to that, in Sarasota City, it was actually the shopkeepers that were asking the city council to pass the ordinance because they wanted to have a shop in which people would wear masks, and they felt it was easier to relay that message when it was an ordinance rather than having it seem like the shopkeeper was being draconian about things. So it just was better customer relationships for them.
Would you also recommend the passage of an ordinance, or do you think that's not necessary at this point?
Absolutely. I think there should be an ordinance. In fact, I think that should be coming from the governor. It should be a statewide issue.
Can you also address the medical arguments that people have been making against wearing a mask, that it makes people hypoxic, that they're recycling their own germs, that the masks aren't effective?
Kirk, you want to take that one?
You know, okay, so as a pulmonologist, it's extremely rare that there will be a CO2 buildup. It will not make them hypoxic because they're still breathing fresh air through the mask, unless it's a ridiculously inefficient mask. But it's time to stop debating whether or not to wear masks. We've decided that wearing masks will decrease transmission. This is the way we're going to attack this right now. So let's everybody pull together, wear your mask, stop debating, and just do the right thing.
After the surge started, cases were going up, hospitalizations were going up, and state officials were pointing at the fact that deaths weren't increasing to match the spike in cases as perhaps a glimmer of hope. Well, deaths have gone up significantly. And now they're pointing at the hospitalization rate and at the positivity rate. Dr. Gordillo mentioned that there may be a bending of the curve. Are you seeing that locally, and do you think that's a trend, or is that going to be just a blip before more bad things happen?
Well, I think it's real, because I think the public in general, you know, once we give a clear message, they start doing things better. They start wearing masks more. They start physical distancing. So we're going to start seeing the early signs, and the early signs is going to be the counts will start coming down. The positivity rate will start coming down. The hospitalizations is a lagging indicator. So the hospitalization decrease, it will take a couple of weeks before we start seeing that. We think that we may be start seeing a slight decrease or at least stabilization in the hospitalization rate. It's not growing as steeply as it was before. So we're starting to see a stabilization of that. The death is even a further downstream indicator. So yes, of course, 3-4 weeks ago, the deaths were not going to be there, but now we're fast forward 3 weeks, we're starting to see all the deaths. And the deaths will continue for the next few weeks, even though other indicators, other earlier indicators will improve. The deaths will probably be the last one to improve because the people that are very sick are already here in the hospital, and it will take a few weeks for them to pass. So just keep in mind that that's the sequence. This is a natural sequence with this disease. The first thing that will go down will be the cases, the positivity rate. About 2 weeks later, you will see the hospitalization, and 2 weeks after that, the deaths. So when we're trying to reverse this, the same thing, the same orderly sequence of events will happen.
Thank you. I'll let somebody else get some questions in.
Daniela?
Hi, good morning, everyone. So my first question is for Dr. Volker, and obviously Dr. Gordillo can jump in and give us his opinion too. But when it comes to the different trials you guys have done, like convalescent plasma, remdesivir, which has been the most effective for you guys so far? I know some of these trials you guys started back in April, so it's been a few months. What has been the most effective so far in order to get people out of the ICU and out of the hospital?
Good question. Sometimes the nature of the clinical trial, these patients are so sick, so complex that it's hard to tell. Remdesivir, we know that it has efficacy, but the convalescent plasma, you can actually see that people will be spiking temperatures, and then 12 hours or so after giving the convalescent plasma, you can see things calm down. Now, whether that has a long-term benefit in mortality, that's what we tally up the numbers at the end. But we're still looking at, different studies like Dr. Gordillo is looking at the monoclonal antibody. We've got, every day I get 2 or 3 new studies that I evaluate to see what I want to bring to Sarasota. And so there are a couple more that we're still looking at that have some potential for when people are sicker on mechanical ventilation.
I have to add that there's been large clinical trials, and one of the largest was the dexamethasone, which is not a new drug. Actually, it's a drug that's been used for many, many years. In a large study performed mostly in the UK, showed clearly that there is a survival benefit, especially in the sicker patients. So that's something that we've been using for several weeks as well. And the remdesivir, like Kirk said, went through a large clinical trial that was placebo controlled and clearly showed that remdesivir shortens the duration of the illness, and in certain groups, in certain subpopulations, gives a survival advantage.
Yeah. And Dr. Gordillo, I know you kind of mentioned that you hope that it plateaus soon or see a slight decrease of hospitalization soon here in Sarasota and for SMH. Aside from the masks, is there anything else? And, we talk about social distancing and masks, and it's something we've been harping on since March and for the last few months. Aside from the masks, is there anything else people can do in order to try to bring those hospitalizations down? Because it seems like a lot of people are back to normal, business as usual.
Well, I think that it has to be a concerted effort between us, the public, and our governments. I think the public is more important than the governments in this case, but we need to work together, and we all need to work together. I think that with all the messages that have been given, I think there's been a change in the way we do things. I think the bars, for the most part, are closed. I think the large gatherings, I think that also have been receding a little bit. We don't see the large gatherings anymore, or not as much as we used to see. Even the private gatherings, people are taking heed of all the advice that we're giving, and they tend to be smaller, and all that is going to have a positive impact. And I think we should not fall into despair saying that, okay, we're doomed. You know, I think the public is receptive to the message when the message is conveyed the proper way. So I think I'm hopeful about that. And unfortunately for this virus, what we have are the measures that we've had for 100 years, going to 1918 or probably before that, you know, which is physical distancing, masks, hygienic measures, stay home when you're sick, you know. And then and this is when we're out of control, like we were in the last month or so, we need to try to reignite all those policies. Once we get the numbers down, we need to work with the government in improving our testing. You know, the testing still not available for some populations. It's not accessible to some populations, and especially the turnaround time of the test is horrible. It's very sad that, you know, we're 6 months into this outbreak, and the turnaround of the test when you go to UTC Mall or one of these places is sometimes up to 2 weeks. That is obviously something that is not actionable. There's nothing we can do when you get the results 2 weeks later. So we need to work with all the authorities that control and that work on this to improve that. And also we need to work with the health department in the Florida government about improving contact tracing. Right now, when the numbers are so high, it's very difficult to do any effective contact tracing. But once we get that down, we need to work with them in improving their capability to do contact tracing. And the public needs to be understanding also that contact tracing is important. When I talk to the contact tracers, they're very discouraged. They call people and they say, well, don't bother me, you know, call me, I don't have time for you. So they're only successful in getting through and doing any contact tracing in only a fraction of the people that try to contact. So the public need to understand that, yes, testing is important, contact tracing will be important once we get the numbers to a lower level.
Okay, and lastly, my question for y'all is about the ICUs. What's the trends that you guys are seeing right now? I think it was about 2 weeks ago that you guys were talking about, it was trending a little bit younger of ICU patients between late 50s and 60s. What's it like right now, and what's the trend you guys have seen in the last few days?
Yeah, right now in the ICU, I think we have 24 COVID positive patients. I'm in charge of 2 of the ICU units. And over the last 2 days, we've seen some decompressing of the ICUs, which is good. We still continue to get some patients in from other counties. And so it's hard to say, you know, how much of this is Sarasota, but I am seeing an improvement, a decompressing in the ICU, which is a good sign. And probably about 80% of them are on ventilators. In general, when our COVID patients are on ventilators, they spend a longer time on the ventilator. They're usually about 2 weeks or so on a ventilator. So it takes a while to get them in, get them out.
Okay, thank you guys so much.
Jewel?
Good thing, because now nobody can really see me. Yeah. I'm exposed.
If you drop that horrible chair you're talking about, like all the way, no one will really.
Yeah, but then you're like this.
And then it's like just like a great something.
We'll move on to Valeska.
So as far as the increase in hospitalizations, how has that affected transports from local nursing homes, assisted living facilities into the hospital?
Can you repeat the question? You broke down a little bit there.
So how has the increase in hospitalizations affected transports from local nursing homes and assisted living facilities to the hospital? I know towards the beginning of March, we were trying to help that spread, stop that spread in the nursing homes just for that age group. How has that affected now, just because you guys are having an increase in hospitalizations?
So at the beginning, we noticed that the hospitalization in this second phase was a little bit different in terms of the demographics. It was a younger demographic. We were not getting patients from the ECF and the ALFs, the assisted living facilities, the extended living facilities. But as this situation matures, then what you would expect is happening, where the young people pass it on to the older people. So now we're starting to see also an influx of, as the younger population start receding, we start seeing some cases coming from ECFs where the virus was introduced, mostly through people that work there that tend to be younger. So yes, now we're seeing the reversal of the age. I think the age groups are starting to, the demographics are starting to show that the age is climbing a little bit, and we're getting the elderly coming into the hospital from ECFs a little bit more. And of course, that population has a higher mortality. So we're seeing people coming in the octogenarians and septuagenarians, and they just because of the nature of their age, they have a higher mortality.
And as far as I know, there has been a lot of talk of vaccines, but we obviously know that's somewhere in the near future. Is there anything that SMH is working on now towards that, besides the clinical trials that you guys are doing?
It's a good question. The pace of vaccine development is nothing short of breathtaking. Remember, we only found the sequence of the virus, we learned in mid-January. I think the same week, the vaccine developers started working on the vaccine. Now, 6 months into the epidemic, we're at a stage that normally would take 6 years. So in 6 months, we've done 6 years of work in terms of vaccine. Most of the vaccine, the first generation of vaccines at least, are in the phase 1, phase 2 trial and getting ready to start phase 3 trials, which is the ones that are done at the community level, and it takes several thousands of folks to take the vaccine in order to see whether they're efficacious or not. So most of the vaccine developers are either starting now, will start next month, or the majority of them will probably start in September. So we're looking to find some partners to do that. We have one particular company that we're looking at to work with, but we're looking at all the options because there are several very promising vaccines out there.
Dr. Volker, do you have anything you want to add to that?
No. Manny said it very well.
Okay.
Perfect. And as far as I know, a couple weeks ago, you guys were at like 3 ICU beds availability. So once you guys do, or near capacity, is there anything you are diverting to as far as SMH?
Dr. Volker, you want to talk
Yeah,
about
we're not on at capacity. We actually have improved ICU beds. I'm in the ICU this week, and we are opening up more beds. We do have the ability to expand and contract our ICU beds. The problem is that our staff is dedicated. They're taking on extra shifts. They are our critical resource more than the actual physical bed. And it's amazing, you see the respiratory therapists, the nurses, the PCTs that have to go into these rooms and flip people over on their bellies. It takes 5 people sometimes. They are working so hard. They are so dedicated. And I think that the community should be thankful for all that they're doing. But the number of beds are not a problem right now. The number of ventilators, we have plenty of ventilators. It's just right now resource staffing, and we have, as I understand, some contracted people coming in over the next couple of weeks to help with that.
Perfect. All right. And I'm good. Thank you.
Yeah. Justin, I think you jumped in. Justin, do you have any questions you want to ask?
Yeah, and apologies for joining the call a little bit later, guys, with news chat. I apologize for missing the first couple minutes. If the doctors should just maybe update where do you guys stand with your remdesivir supply? I know there've been a shipment earlier this week. I apologize, it's already discussed, but if Dr. Volker just talk about, where you're in terms of supply of remdesivir. The governor said more will be getting shipped out, and just does this remain maybe the most promising antiviral drug you've been able to use on patients in this fight against the virus?
So Kirk answered that question before, but and I can tell you, right now, remdesivir is a transition from the clinical trial supplies and all the supplies that Gilead, the manufacturer, had to a commercial distribution. So right now we're kind of in that limbo there in between. So the government and Gilead is working in a system for distribution. So every Monday we get a supply for the week. So last Monday we got 100 doses, and so far we've used about 67. So we have 33 for the rest of the week. Next Monday we will get another supply. We don't know how many that will be sent.
And one more, if I could, gentlemen, with the patients you are now seeing, we talk about people younger testing positive. Are you seeing sicker patients in the younger age groups as well, or the ones who are most predominantly facing severe health consequences remain the older patients that you guys have seen?
Dr. Volker, can you talk about what you're seeing in the ICU?
Sure. Over the last 2 weeks, we've seen sicker patients who are younger, sometimes in their 40s, 50s, 60s, rather than a few months ago when it was their 70s and 80s. Youngest patient was 19, and fortunately, he actually only spent a couple of days and did not need to get intubated. So we are seeing younger people, but they heal better. So that's a positive.
What is the biggest thing you guys have learned now from when this pandemic started that helps you and your team to get better outcomes with patients? What's the biggest thing you guys have learned now?
Yeah, that's a good question, because the whole idea of shutting down the economy to flatten the curve was to sort of let us catch up. And so what have we learned from that time period? One is we're using now dexamethasone, which is a cheap steroid, routinely. We're using remdesivir, we're using the convalescent plasma and the monoclonal antibody, but we're also sort of learning good, solid critical care management of our patients, which helps in the long term. Just something that may make just a percent difference saves lives, saves that percentage of lives. So we've learned a lot through this, and we continue to learn. We actually talk on a weekly basis of reviewing all the new literature. This thing is evolving rapidly, but we're learning rapidly.
And lastly, again, I really appreciate you guys doing this. You guys have been so helpful throughout the whole process with the updates the hospital has provided. Just with regards to the question of the children going back to school, is there any evidence to support that children, those who are younger, aren't as likely to transmit this virus to, say, their parents or to others? Because that is, a big talking point we're hearing about the school debate. Just, is there any evidence to show children are less likely to transmit this virus to adults, or is it really still too early to have a solid scientific answer?
So up until recently, we did not know the answer. We did not have solid data. Last week, South Korea published their national experience with this, and it does seem that younger children between ages 1 and 10, they transmit the virus less to adults than older children. It's not clear why that is. There's speculation on maybe it's because of their size. Their mouth is smaller, the voice is not as loud, and they do not generate as much virus. Sometimes some other people say it's because their height, because they're at a lower level. Whatever droplet they produce, they settle into the floor more. But it does seem to be, this is tens of thousands of children that have been analyzed looking at this problem, and it does seem that the younger children are less of a problem as vectors. Now, it doesn't mean that they are not. You know, it's just a degree of contagiousness is less. So that doesn't exonerate them as a potential vector condition, but that's what the studies seem to show, if that was your question.
Yes, sir. Thank you so much. Appreciate the answer.
Everyone so much for joining the call. I think I got to everyone. If I didn't, feel free to unmute yourself and shout. But if I did, Dr. Gordillo, Dr. Volker, thank you again for helping us answer questions and get good information out to the community. And we thank you all for helping us alert the community as to our needs. And we will speak to you all very soon. Stay safe and healthy, everyone. Have a good day.